Yeah.
So, hi, Amartya.
Yeah. Hello, sir. It's great to
Hi,
have you.
how are you feeling right now?
Okay, the feeling has finally sunk in. It's been a couple of hours, so I feel great, I would say. Yeah.
So, actually, I was traveling, so I just parked my car right now at the end, and that
Yeah.
taking.
Yeah.
And
Yeah.
Frank, I have taken an order of couple of paranthas right now, and just take.
Where are you right now? Delhi?
So, traveling to Chandigarh at this point of
Oh,
time.
all right. All
That
right. The highway is good. The highway is really good. I know.
is that.
I've been there. Yeah.
So,
Exactly.
parked my car, and I thought I'll just have a talk with you because
Sure. It's really
it's
good.
a great moment that we're having right now. I hope.
Yes, sir. Yes, sir.
So, man, tell me about your journey. How you are able to reach this moment. How is that
Um,
possible?
I would say 99% hard work, 1% faith. Like what Neymar usually says, because I mean, with hard work you can achieve, say, like 80% of what you're supposed to achieve. After that, it's a matter of luck, definitely. And I mean,
Of
I was
course.
lucky enough. I would say I would definitely say I was lucky enough to be rank one, because like rank one is just, I mean, it's too much. It's too much.
So, I will be frank over here. You are
Yes,
a
sir.
basic plan user in
Yeah,
eGurukul,
basic
bank
plan.
test user of eGurukul. So, tell
Yeah,
me
yeah.
about with that.
Yeah, so I took the GT series of DBMCI in, I would say July of 2020. Yeah. So since that, I would just regularly give the GTs, be regular with that, and then follow that up with the discussion. I mean, the discussion and whatever the solutions that were given at the end of the tests. And yeah, I definitely also took those, I mean, GCLTs. They call GCLTs over there. So I took them as well on my laptop. I would say I took these, tests particularly on the laptop, the GCLTs and all the grand ones. I took them on the laptop, and yeah. So again, I used to give grand tests frequently, for initially like 1 GT per 2 week, per 2 weeks, and then I sort of increase the frequency to like 1 GT per week towards the last month of my preparation. So that's that. Yeah.
You have been in a Super 30 group, right? So the Super
Yeah.
30,
Yeah.
I think the best part about me, if you ask me that, just having you in that group, and when we asked you the results and that result came up, now that was a very great feeling for myself. So I can imagine that I can reciprocate that in the same feeling into you, right?
Yes, sir. So one thing, that there is one funny thing this time. Like I would say, I recently saw the AIMS, the PDF. Okay, there's one funny thing. There's actually two rank ones. Okay, there are actually two rank ones, mind you. I have got the rank one. There is someone else also with the rank one. And then there is rank two as well. So I just checked it once more. I'm rank one definitely, but there is someone else who is rank one as well. This has never happened before in names. So maybe we
Yes,
got the same number of maybe we got the same number of correct responses at the same time. So that's really magical. Yeah.
that is happening for the first time. And to be very frank, uh, I think this is the second or third attempt of INI-CET, and
Mm,
the coincidence in the very first or second, third time,
exactly.
it's like a
Exactly.
very big coincidence right now, right?
Exactly. So this was my first attempt at any national level exam. So I mean, to get this at my first attempt, it's just something right out of a comic book, maybe. Yeah, if I could say that.
A piece of advice for all the viewers right now who are praying for NEET PG.
I would say these 40 days are very crucial. I don't know, it's 40 or 45 odd days we have right now. They're very crucial. So plan properly. I mean, the plans again should be short-term plans. They should not be very lengthy or cumbersome, and something which should be very doable. Okay. So first of all, I will reiterate the fact that you can at least complete one full revision of your notes. do that. Definitely just one full revision of your notes, just the notes you have. Don't just read from here and there. Just whatever you have, whatever source you might be using, just do that. Do your notes just rapidly once. And after that, along with that, keep on practicing MCQs. Like for 1 hour, practice like 40 or 50 odd MCQs related to a particular subject which you're doing, and then do a mixed bag of questions. And so keep this going. And along with that, give one GT every week. Like example, give it on a Sunday. Yeah. So give it on a Sunday maybe, and then spend minimum time on reviewing that, because now it's the end game basically. So you're nearing towards the end. So you don't really want to, spend a lot of time reviewing your GTs. Just look at your wrongs, where you're going wrong, and just correct that only. Okay. And keep on moving forward. So 30 days definitely you must finish at least one complete revision within 30 days. Okay. And with the MCQs and GTs going on, then what you will do in the last 10 days, I personally, what I did is that, again, the past year papers. Okay, so the past year papers, they're very important. Don't miss out on this INI-CET paper, and as well as the INI-CET November paper. And definitely you have to do your NEET PG 2020 paper, and maybe the 2019 paper if possible. But mainly focus on these 3 recent papers, okay? And with that, again, revise these papers in depth. You should not miss any question which comes out of these papers. Like it's very risky. Like if you sort of miss one or two, silly mistakes happen. It's a very routine part of it. I have committed serious blunders in my test as well. I'm pretty sure about that. I marked the non-rebreathing mask question wrong, which is, I think nobody should have marked that, but I did that. So there is no issues with the silly mistakes, but keep that to a minimum. So keep on revising your past year papers, and keep on revising the volatile stuff which you might be having, which you might know about in the last 10 days. And with that, just give NEET PG with a fresh mind. The questions will not be that difficult. It never is. Don't believe in the hype. The questions are standard as always. Might be clinically oriented, but I'm pretty sure each and every single one of you will be able to tackle them, because like no matter what happens, I'm pretty sure we are all good at doing clinical scenarios. This is actually true. Even in fact, clinical scenarios are more high scoring. So I'm pretty sure you people will do well, and all the best for that.
Amartya, I think I'd like to correct you here that I've seen your performance in the last 3 grand tests, and you have been always in the top 3. So even, I know right now that our grand test is given by like 30 to 25,000 people, and you have always scored top 3 in the last 3 grand tests. So after seeing your performance, I could always imagine you being in the top 3, but you have always managed to score rank 1 in INI-CET. And so to all the people who are actually watching this video, please understand this one fact, which is now a perfect example that this rank that Amartya has now scored is not just by chance. It is an example of, consistent performance. So that particular thing, you have to get into your review as well. You have to get that performance into your daily schedule. So, scoring a century is not that easy that you to the park and just scores. It's just what he has achieved. It is 1 in a million kind of thing, because he has already achieved that kind of thing among 35,000 people in the last 3 grand tests already. So give grand tests very regularly. Only then you can ever imagine to be like Amartya over here. So Amartya, I'm telling you that you are an inspiration right now, my friend. And what you have is 1 in a million kind of thing, and I'm very, very proud of you.
Thank you so much, sir.
DBMCI family right now is proud of you. And the Super 30 thing, I think I'm very, one thing that I'm very proud of myself, that I started a Super 30 kind of thing, where every ranker, every hard-working person who wants to achieve something, we can just see that simple push that he needs.
Yeah. It feels good, actually. It really feels good. These small things do add up. They do boost your morale. Like if you get into these things, like it's definitely it's no big deal. It's just a practice. But if you find your rank on the leaderboard, it feels good. It gives you a good push. Like in addition to what you have achieved, it feels good. So these things do add up at the end, and it definitely helps. So definitely it was a great thing to do.
I can always imagine that, because you have done a fabulous work, my friend. And I think I know that I can speak on behalf of many of our faculties, where you have been with many of our times, because I get a report, I get a daily report that Amartya is asking something, this guy is asking something. So I get daily report of us both group, and you have done some fabulous work. You have asked many questions, and to all the viewers, please do not shy from asking questions, because the guy that you're speaking, that guy you are seeing right now, who is giving you a speech right now, he has been asking questions on your behalf. So if you want to learn, if you want to achieve this feat right now, please do not be afraid to ask questions. That is the only way to learn.
Yeah. I mean, I would say that I'm more of a shy kind of person. I don't really ask that much, but I would say, yeah, definitely when you're faced with something of a blockade, okay, some sort of roadblock, some things which you don't know, don't hesitate to ask. I mean, there is no shame. There is no shame really. Even if you don't know a basic thing, there is no shame. Just say it. I mean, you should really have no shame in this medical profession. Even if you don't know anything, I mean, if you don't know one particular procedure, just say it. I don't know. Bhaiya, I don't know. Bhaiya, I don't know this question. Just say it, and you will be helped out eventually. I mean, gali de sakte hai thoda, but after that they will teach you. So in your life, in your work, as well as during the course of your studies, don't hesitate to ask. Okay, like help is there, and help will be provided to those who seek it. So definitely.
But I'm glad, Amrita, that you got this amazing rank, and I got a chance to speak with you. And congratulations!
Thank you so much, sir.
Again, best wishes to your parents as well.
Yes, sir.
So I'll always, when you get a seat in AIMS Delhi, I'm gonna speak to you there in person. So
yes, sure, sir.
Wait to be here. I'm going to wait. I'm going to wait for you here. Thank you so much, and a huge congratulations to you.
Thank you so much, sir. You take care as well. Okay. Yeah.
Bye.
Thank you, sir. Bye bye. Good night. Have a great night. Goodbye. All right. I'm leaving then. Okay. Thank you so much, everybody. Thank you so much. Have a great night. Thank you. Good night.